Good morning. I'm Maria Wharton, and I'm here today to talk to you about our 2016 annual report here at Peace and Prosperity Hospital. This report was put together with a group of our key leaders, including Brett Russell, Bintu Salah, Catherine Victorine, April Witt, and myself. The first thing we're going to look at today is our key performance metrics and just give you a sense overall of what we're going to talk about. So our key performance metrics include looking at the cost of doing business. Did we make a profit that we expected in 2016? Next, we'll look at our inpatient census and look at how well we did keeping our beds full. And then lastly, we'll look at patient satisfaction. How well did we meet the expectations of the patients and community that we serve? So we'll start out looking at our annual profit. So this slide shows you the profit each month for 2016, and then the target profit is that thin line, and you'll note that it really ebbs and flows. It's not a straight line. We don't expect the same profit month to month, but it's based on what we as an organization think our census will be and how profitable we'll be month to month, because we know that that varies. So what some things are that we learned in looking at that data is that we see that there's a direct correlation between our census and our profits, with the least profitable months coinciding directly with our lower inpatient census days. And then conversely, we see our highest profit was realized in October, which was when we had our highest census. Our total annual profits for 2016 exceeded our target by $663,041. So we know that you worked really hard to make that happen for Peace and Prosperity Hospital and keeping us financially stable. So thank you for all that hard work, and make sure that you share our thanks with your staff who made all this possible. There were several factors that we took a look at that we felt might impact our profitability besides our census, and they included things like perhaps there were some unreimbursed care, insurance issues, delays in payment in January and February, where we actually did have a higher census but a lower reimbursement and a lower profit. We also know that in the months where the census is low, like in those early summer months, that there might be a trend towards some unnecessary admissions. Patients that if the hospital were full might have just been in observation in the ER and not admitted, and those patients would usually have a lower severity index of illness and be less profitable for the hospital. And then patterns of where patients were admitted as well. So patients coming in through the ER, again, the payment structure is different. That impacts our profitability. The last thing that we took a peek at was our fall rate. We looked specifically at April, which was our least profitable month for 2016. We thought maybe, patients who have a fall and have some complications, their care is more costly, but the hospital does not receive a higher reimbursement for that potentially avoidable event. But we did note that the average fall rate was 3.2% in April, which wasn't out of the ordinary compared with other months, so that didn't seem to be a factor in our profitability. The next metric we looked at is our inpatient census. Again, you'll see it month by month for 2016, along with a trend line that shows that even though our census went up and down from month to month, we did have an overall increase despite that summer slump. And we know that for those of you here who are managers of units in the hospital and trying to juggle coverage for staff who want to take vacations during the summer, it has to ease your burden a little bit to see that in the months that you have staff who want to be on vacation, we also have fewer patients to take care of. What else did we learn in looking at that data from our inpatient census? We did note that the census begins to fall once flu season is over, end of March area, April, and then it picks up once again when school begins. So we know that those communicable diseases in our communities and changes in activity levels when people begin to be spending more time together in confined spaces impacts our census in the hospital. As we said, the census trended upward, and we were happy to see that. But we did note that even though it did trend upward, we continue to have excess bed capacity in that our census, in terms of meeting or exceeding a 90% census, we only achieved that 2 months of the year. So we definitely have space in our hospital to care for more patients and can work on that in 2017. Lastly, we looked at patient satisfaction by department. So here it is by each of the departments here at our hospital. That reference line there is the national benchmark of 72% set by CMS. And you can see that we exceeded that in every department except for the emergency department. Overall, for the entire organization, even though we were looking at it by department, the entire hospital's satisfaction rate was 82%. So we should be very proud of the quality care we're providing to our patients, and we know that our biggest opportunity for improvement is in our emergency department. And we want to thank the maternity department and the cardiac step-down unit, who had really strong satisfaction results that helped contribute to that 83% for the entire organization. So looking at what we learned by looking at our patient satisfaction data, we know again that that benchmark from CMS looks at two things. It looks at the overall satisfaction, which is at 72%, and also the percentage of patients who will give the hospital a 9 or a 10 out of 10 on a satisfaction scale, and that number is also 72%. So again, please convey our thanks to your staff for their hard work in ensuring that our scores are higher than that benchmark. Knowing that we need to set some goals for 2017, so we want to make sure we continue to achieve those high benchmark scores in all those departments, and that we work to increase our emergency department score to 62% satisfaction rate in 2017. And again, we know that's really a stretch goal, but it will help get us closer to that 72% benchmark that we want to achieve certainly by 2018. But in order to do that, we're going to have to figure out why our patients aren't happy. So that means looking at some of those surveys, talking to patients, and understanding what it is that we need that we're not providing. We know that one of the issues that's a sticking point for our patients is wait times in the emergency department. Our average is about 1 hour and 45 minutes, which is a long time to be sitting in the waiting room if you don't feel well. So if we can do something about that fairly quickly, that will go a long way to helping achieve our higher satisfaction rate. But then we also have to understand what other things our patients are experiencing that are not up to what they're expecting, and that will inform some performance improvement projects for us, and again, help get us toward that goal where we want to be. So in conclusion, Peace and Prosperity Hospital, we were able to meet our key benchmarks in 2016 related to cost, our inpatient census bed capacity, and our overall patient satisfaction. And again, we really need to celebrate that we exceeded our target profits by $663,041. We know a contributing factor to the hospital's ability to make a profit was the increase in our inpatient census as we operated at a higher capacity in the last half of the year. And this allowed us to exceed our target profit. And again, that month of October, where we had a really high census and a nice profit that went along with that. We want to celebrate that we exceeded the patient satisfaction on a national level. We exceeded that 72% in 9 out of our 10 departments, but we know we still have room to improve. And then we need just to understand why patient satisfaction is important. It's a motivating factor for stakeholders and consumers. It's an indicator of the patient's perception of the quality of care provided by the doctors and the hospital, and it's based on efficiency, timeliness, and the delivery of high-quality patient-centered care, all things that are important to us. And we know that that satisfaction can influence the hospital's profits, and we saw that in our analysis. Satisfaction is not influenced by clinical outcomes, and it means that we need to be attentive to our ability to retain patients, to have them come back to us again for care, and to understand the risk associated with medical malpractice claims that can come from unhappy patients, and knowing that high medical malpractice costs can reduce a hospital's profitability. So that ability that we must have to retain our patients due to our high satisfaction rates and high quality services has positively impacted our profits. And so our goal for 2017 is continue to improve the quality of care in the emergency department, focusing on wait times and whatever else we learn from our surveys, and then continue to increase patient satisfaction so that we're meeting or exceeding the patient's expectations at all times, knowing this will have a positive impact on our hospital profit and our reputation. We want to thank you for all that you do to help Peace and Prosperity Hospital provide the excellent care that helps us to achieve our goals. We now have time for some questions, and we want you to know that as you take this information back to your units, if you have more questions or your staff have questions, we're happy to come meet with you one-on-one or with a small group on your unit. You can reach out to me or any of the other leaders who put this presentation together, and we'd be happy to come and talk with you. Thank you again, and now if you have any questions, and if not, have a good day.